Hello everybody. So you saw the title of this video. I have to do a disclaimer. I am not a doctor. I do not work in medical care or anything like that. And so I am not trying to give you medical advice. I'm just going to tell you what I have experienced being on Ozempic. So let me start. I got little notes here, and here's the box. You see, I'm covered this up with my info. But let me get started. In October that just passed, I was at my doctor's office, and my doctor, she said, your A1C is still 12. And she said that can be deadly. You can have a stroke or you can have a heart attack. She was going to put me on another drug that's almost like Ozempic. So they called, I guess, my insurance, and they checked, and they said they wasn't going to cover that drug, but they said they would cover Ozempic. I was surprised about that. I started taking it in October, and what I'm going to do is, in this conversation, I'm going to tell you the pros and the cons of taking Ozempic, okay? Make sure, if you're thinking of taking Ozempic, go to your doctor, tell them everything that you're on, because you don't want no interaction. So yeah, I started taking it in October, and Ozempic is for people with type 2 diabetes. I didn't want to take no Ozempic or none of that stuff, but I guess to save my life and make that A1C go down, I had to do something. Okay, so Ozempic is very easy to take because you just take it once a week. It's an injection. I'm used to taking injections because I take insulin and what's the other one? Metformin. And I still have to take those drugs even on Ozempic. Okay. So yes, again, my A1C was 12, which could be deadly. But while taking Ozempic, my A1C went down to 7, and my doctor was so happy about it, and I'm happy about it. So it will make you lose weight to help control your diabetes. I'm not taking it to lose weight, but a lot of people are. Okay. I never feel hungry at all. Not at all. I feel so full all the time. I have to make myself eat sometimes. Eat a little something. Because I'm on so much medications, I need to eat some food. I am not out of breath as I used to be. I used to have frequent asthma attacks. I haven't had that in a while. That's a good thing. And so I'm going to tell you the cons of Ozempic for me, okay? I feel nauseous all the time, y'all. All the time I'm nauseous. My doctor keep asking me, I have a gastrointestinal doctor because I have a lot of stomach issues. And so he asked me, do you vomit or anything? I said, no, I haven't vomited yet, but I be feeling nauseous all the time. My skin feels soft and real flabby, and it has caused me to have more wrinkling in my face. That I don't like. Okay. I have a constant bad taste in my mouth, and food does not taste the same. So around the holidays, I ate some things that I wasn't supposed to eat, but nothing doesn't taste the same anymore. And I miss the taste of food, especially real good food. I miss it. I have pain in my stomach sometimes. It can make your blood sugar to suddenly drop. And when that happens, I have to carry some, eat 2 pieces of the hard candies or something like that. Because if it gets too low and you don't do something about it, you could pass out. Okay, I have been losing more and more hair. That's not good at all, because y'all know my struggle with hair. So, getting back to the wrinkles. That's one of the reasons why I didn't want to do it. I'm going to be 60 in July. My birthday comes. And I mean, I know I'm elderly, but no. Face ain't supposed to be cracking like that, like this, you know. So that's one of the things that I am dealing with right now. My stomach doctor said that there's a possibility that I may not be on this medication for a long time because my gastro problems that I'm having may not be good for me to take Ozempic. But he's keeping me on it because I have so many things going on, and he said that the drop in weight may help me. So, I'm going to tell y'all the truth. Years ago, I was between 240, 245. Okay. So even before Ozempic, the doctor put me on, I'm sweating. The doctor put me on some kind of medication, and I can't think of what it is right now. But I was starting to lose a little bit of weight, but not a whole lot. But I was losing a little weight. The last time they weighed me before Ozempic, I was 235. So now I am 208 pounds. Okay. I'm thinking this last week I done gained a little them pounds back. If I find something that I like and don't feel as nauseous, I eat that. Ozempic is definitely not for everybody. You may start off on Ozempic and you may not be able to stay on it that long. And I have seen people here on YouTube that take the Ozempic and they get real, real small. And then I don't know if they can't pay for it or what, and they stop it for just a little while and all that weight comes back. So I was talking to the doctor about that, and both of my doctors. And one, she said, yeah, it's true that you will gain all your weight back and probably more. I'm saying to myself, that don't sound too good. Maybe if it's some way that they can put me like on maintenance where I don't take it all the time, maybe they can do that. I don't know. I don't know enough about this medication to say what they can and cannot do. But my doctor said that the truth is Ozempic helps with a lot of health conditions, but it's some things that come up and we're not, we don't know what will come up and you will have to get off it. Or he said it's a possibility that if we have to take you off Ozempic, then we might be able to put you on another drug like Ozempic. I'm like saying to myself, if you take me off this, why would you put me on something similar? So anyway, y'all, I'm just telling y'all my experience. I feel that Ozempic can make you lose weight a little too fast, at least in my case, because I don't like these wrinkles. And they saying you can get the Botox and fillers in your face, and does it look like I can afford all that, y'all? No. I'd rather lose weight gradually, So I am not out of breath like I used to be. I do feel a little difference since my A1C dropped. So I think this month I have to go for testing to see did it drop even further, the A1C. And so they're trying to get it down as low as they can. But yeah, so y'all, I'm on Ozempic. Don't know how long. I will talk to you again soon. Thanks for watching. Bye.